Hey guys, so today we're going to be talking about motivational interviewing and the various different parts of that. So with that, we'll go ahead and get started. There we go. Okay, so let me make sure. Okay, so looking at the quick overview for today, we'll go ahead and look at the theoretical underpinnings. Then we'll go ahead and break down a case vignette. Finally, not finally, moving into strengths and criticisms of motivational interviewing, then looking at the multicultural considerations when using motivational interviewing, and finally, both a conceptual and then a effectiveness and efficiency comparison of motivational interviewing to other types of therapeutic approaches. So with that, we'll start with the theoretical orientation. So motivational interviewing actually originated in the field of substance use disorders. It demonstrated to be overall effective in reducing substance use, risky behaviors, and all the while promoting healthy behaviors. It's based in person-centered therapeutic intervention. It does this by working on the individual's personal ambivalence. And so the primary focus here is the internal motivation rather than the external stimuli. It places a particular emphasis on the patient's motives, strengths, and internal resources. It also helps direct the client's thoughts and cognitions towards modifying behavior without directly providing advice. And so it does this via the creation of a non-threatening environment to enhance social support and in many ways bypass the psychological resistance that many times in the therapeutic room we come up against. And so, with that, I do want to just give a quick overview or a quick review of person centered therapy. So, it was originally theorized by Carl R. Rogers, who was really focused on helping relationships, specifically within a human life. And this is a very self directed growth process that produces a therapeutic relationship primarily characterized by genuineness, non-judgmental caring, and empathy. And so one of the things to really keep in mind here is that we also look at something called unconditional positive regard, which we'll dive into here in a second. But it really helps lay the groundwork for what exactly motivational interviewing even does in a therapeutic setting. Whoops, my okay, you might have to do it like this because my screen is freaking out a little bit. So, a thought on change. These were two quotes that really stood out to me when looking at uh, motivational interviewing. So I'll go ahead and read them off to you. The first is I realized with some shock the personal and professional inclination to blame, judge, and label others for being resistant and not motivated was not confined to the addiction field. MI provided a different way of approaching these conversations about change. Joanne then continues this conversation with if you treat an individual as he is, you will stay as he is. But you treat him as if he were what he ought to be and could be, he will become what he ought to be and could be. And so this really is getting at the essence of motivational interview, which helps us begin to look at the discussion of the key components of motivational interviewing. So it all starts off with evocation. And so evocation is really the process of bringing up these past experiences, these past memories and thoughts and feelings, and laying them out on the table. It does this through a more collaborative sense. And so something that we've talked about thus far in this semester is collaborative empiricism. And motivational interviewing really emphasizes that. It focuses in on the therapist is a expert within their own field of conducting psychotherapy and helping the individual through this process, while the individual is, in their own sense, a an expert within their own lives and within their own experiences. And so, when we come into this collaborative space, that's when the process of change can ultimately begin to take place. We then look at the elicitation to support patients' autonomy. And so this is really the understanding that the individual has their own say and own direction within their own life and where they exactly want to go. We do this through a process called unconditional positive regard, which I just brought up a couple seconds ago, and which really brings up and emphasizes this point of creating a non judgmental space in which the individual can be fully accepted for who they are. What's interesting about motivational interviewing and person centered therapy, that what it's based on, is it's theorized that it's not just unconditional positive regard is not just for the individual, it's also for the therapist. And this understanding that the therapist is unable to create a space of non judgment unless they can fully accept themselves for who they are as people as well. And this is all done through a compassionate and empathetic way of fully accepting that person across in the therapeutic room. And so, something that I think is really helpful to kind of paint this picture as I was thinking about motivational interviewing, and maybe something that we see in a more day-to-day life situation, was in fact dogs. And so there's a picture of one of my dogs growing up, and some of my fondest memories is with him, Deegan. And what I can remember about Deegan is that he was constantly loving, caring, showing up in a very non-judgmental space. And I think a dog is a great representation of that. And I think many of the characteristics that we talk about in motivational interviewing, outside of obviously the conversation, but just the ultimate presence, we often see in a relationship to our pets. And so, Deegan, for example, every time you would interact with him, he not only was not judging himself, he was just being who he was. He was also fully accepting us as his owner, and no matter where we were, fully accepting us. While also recognizing that we are our own people, and we, as a result, will lead our own lives. And he was fully like just along for the ride with us. And so I think that type of relationship, if you will, is a great example of what it looks like to take on the spirit of motivational interviewing. And so, let me close this. Okay. So then we have efficacy and effectiveness. So motivational interviewing has been researched as a standalone treatment modality, and it's recently been validated as an evidence-based treatment. And it's been validated for things such as smoking cessation, substance use, and that substance use covers a wide range of substances. So some of the things that through reading some of the current research I saw was things like alcohol, cannabis use, opioid use, even methamphetamine, actually, which was pretty interesting to dive into. Additionally, motivational interviewing has been found to be effective in weight management, dietetics, nutrition, even in things like psychosis and schizophrenia. Additionally, it has been useful in the process of change for individuals who want to stop gambling. Okay, so with that, I kind of want to dive into a quick case vignette. So we have this patient, Sarah. And I'll go ahead and read off kind of what Sarah is going through. So, Sarah's a 28-year-old woman who works as a marketing executive at a prominent firm. She presents to therapy with concerns about her alcohol use. Sarah reports that she typically consumes 4 to 5 drinks per night, often alone at home to unwind from work stress. Lately, she has noticed that she has been drinking more frequently and sometimes struggles to stop after just a few drinks. Sarah acknowledges that her alcohol use has started to interfere with her sleep, productivity at work, and her ability to maintain healthy relationships with friends and family. She expresses concern about her drinking habits and the impact it may have on her future if left unchecked. And so, really emphasizing that it's starting to become very distressing and impairing for Sarah in her day to day life. And so then motivational interviewing, kind of more in action, would have a few goals that we would work through with Sarah. The first is exploring that ambivalence, helping Sarah identify and explore the conflict that she is feeling between her alcohol usage, which in some ways is being perceived as a benefit, because she's using it to self medicate for that stress, to relieve from that stress. Or on the other hand, that alcohol consumption is posing many negative consequences in her life, such as her social life, her work life, those different types of things. We'd also then want to work on eliciting a self motivational statement. So, really encouraging Sarah to and explore in this autonomous fashion her own reasons for wanting to change and her goals for the future, highlighting this intrinsic motivation to make those positive changes within our own life. And then finally, we would enhance that discrepancy. So we'd really help Sarah begin to see and recognize discrepancies between her current alcohol use and her broader life goals and values and aspirations. We could do this to all by uh, fostering cognitive dissonance to motivate this change. We would then help support this self efficacy. So we'd want to make sure that Sarah knew she could do it. We'd remind her and help strengthen her belief in herself by highlighting past success stories that she has had, and really collaboratively develop a realistic and achievable plan to reduce that alcohol consumption. Again, we developed this smart plan in a very collaborative empiricism way, understanding that Sarah ultimately needs to have the biggest say in that plan because if she doesn't have big buy-in, it's going to be tough to change. And so we will begin to explore using SMART goals, but then explore coping strategies, more healthy coping strategies to help manage your stress and other triggers without relying on the usage of alcohol. And then finally, we would normalize that ambivalence, helping her to understand that some of this anxiety and even resistance that she may come up against about change is very normal. And that setbacks along the journey is also part of the process. And we would help provide that reassurance and continual support throughout the stint of her journey to change um, her current experiences. And so then I want to dive into some of the strengths and weaknesses in motivational interviewing, specifically within the therapeutic realm. So it has been particularly found to be efficacious in the treatment of substance use related psychopathology, which is again one of the greatest strengths of motivational interviewing. It also helps to reduce risky behaviors and increase the amount of engagement in more healthy related functional behaviors. It also helps to resolve ambivalence present in the individuals with a self-caring fashion. And something else I want to emphasize is it really starts to hone in on the therapeutic alliance, really working to, by developing that unconditional positive regard, having this relationship with the client in which the client can fully be themselves and can feel strengthened in that therapeutic alliance, but then also at the same time emphasizing that the individuals have everything that they need to change their current experiences. However, there are some weaknesses of MI. One of the things that kind of stood out in some of the readings was the dissemination of MI into mainstream practice. So, particularly within behavior analysts, there's this misalignment between motivational interviewing and behaviorism and the behaviorist principles, and thus it kind of inhibits the dissemination of it. We also have limited knowledge of its effectiveness across different psychopathologies. Additionally, we might meet some client resistance in the journey to change, and that's something that we should be um, very ready to face within the therapeutic room. And so, another aspect of motivational interviewing is its cultural adaptation. Um, Before I dive in too deep, I think it's important to provide a nice framework of some of the theorized ways to culturally adapt psychotherapeutic treatments. One of the ones that I found actually very helpful was Resin Cow et al. 1999, who provides a structural framework for the adaptation of psychotherapeutic treatment, parsing it out into two foundational categories, one being surface and the other being deep. Now, surface really involves the process of evolving the treatment to match the delivery and setting to ensure the greatest fit with the target population's culture, experience, and behavioral patterns. So, this essentially helps to establish the implementation and the implementive ability of the treatment for the specific culture. That way, it is taken up. Then we have deep. So we begin to focus on how the cultural context of the target population begins to influence what is conceptualized as a functional behavior, a desirable behavior, and even a maladaptive behavior. Because within the treatment room, if we don't have a good understanding of what specifically is distressing for the individual within the therapy room, it might be difficult for us to treat them because then we're kind of doing a catch all approach, and that's not the best way to do things because their culture is going to help influence what is healthy and what's desirable. And so this will help us to understand the degree of stress certain behaviors may have on the target population, and then we can adjust the treatment to target those to put them in line into more functional and adaptive ways of behavior. And so, Self et al. 2022, I think, provided a really good summary of adaptations of psychotherapeutic treatment. And so, when we are beginning to adjust psychotherapy, we have to look at various things. We have to look at things like language, persons, the metaphors, the concepts, the ways in which we adapt it, and then also ultimately the context of the culture. So I thought this was a really helpful breakdown of the dimensions of adaptation when we're working through adjusting psychotherapy to fit a specific culture. I think another thing to keep in mind, actually, Owen Lee 2016 brought up, and this is a table from their paper, was some of the things that we as clinicians should keep in mind, specifically within the context of MI. We should have an ability to inquire more about the ethnic background. So, looking to understand the identity, the language, the spirituality, the weight that they place within their culture, the ties to the community. We have to understand that we do not under we are not the expert within their own lives. And there is a sense of humility that has to be met in working to understand their ethnic background. Another theme that we've talked about over this semester is acknowledging the biases, stereotypes, even prejudices that we hold maybe unconsciously against certain cultures. And this again comes back to that unconditional positive regard towards oneself, beginning to do that reflective processing and change within oneself to ultimately have a better understanding of where the individual is coming from. Um, we can also then have a greater ability to exhibit greater cultural competence about their celebrations, their ceremonies, their traditions, their spirituality, the things that they hold and value dearly to their hearts. We can focus on those strengths and use things like metaphors, myths, and storytelling that's specific to their culture, which really helps increase their buy-in, which I'll get to here in a second. And then we could do things like develop those discrepancies between the undesirable behavior and the values of the community. So the family, the clan ties, community, spirituality, while also coming to a place of asking the person what their thoughts of what is a potential solution for you for your own problems, and then helping guide them along that path. So recent effectiveness and efficacy studies have begun to look at cross-cultural motivational interviewing. A recent meta-analysis produced recognized MI to have greater effects on ethnic minorities as compared to white samples, and that's not adapting MI. However, additional research has found that MI, when culturally adapted, produces greater treatment effects compared to original MI, and that this might be due to an increase in the client buy-in and satisfaction with treatment, which again we know from looking at kind of the progression we've made throughout the semester is so important that the um, client is ultimately completely bought in and satisfied with the treatment. And we can do this by connecting it to things that they personally value. And when we connect it to things that they personally value, they may ultimately um, feel as though they are progressing towards something that they desire to fit within their community. However, there's still some gaps that remain in culturally adapted MI. So the first is efficacy and efficiency studies are still needed for various cultural backgrounds. It's also important to realize that even within cultures, there's going to be individual differences and heterogeneity within them, which might impact some of the generalizability of the efficacy of culturally adapted MI. I think also it's important to recognize some of the barriers that MI may hold. And implementation science should really investigate how efficacious treatment can be taken up in culturally diverse and marginalized communities and populations while ensuring the efficacious treatment has context specific ecological validity. Because if it's not ultimately applicable to that context and that culture, we might begin to lose some of those crucial components, such as client buy-in, satisfaction, and having um, applying the client's values within the therapeutic room. I think it's also important to identify that we need additional opportunities for culturally adapted MI training and supervision because without such supervision and training, implementation and dissemination of culturally adapted MI is incredibly difficult because one, clinicians might not even know how to begin the process of culturally adapting MI. Um, a clinician can't engage in something that they lack knowledge in. And if they try to change something without having the proper training and supervision, it might ultimately impact the efficacy and efficiency of MI as a standalone treatment. So then I wanted to also look at MI versus other interventions, specifically efficacy and efficiency, and then we'll do a more conceptual comparison here in a second. MI is more effective than no treatment at all. That has been proven specifically using like waitlist control groups. It also has been found to be as effective as other treatments depending on the psychopathology. And so a good example of this is the treatment of depressive-related symptomatology, MI versus CBT. MI was specifically found to be an effective treatment alternative to CBT for depressive-related symptoms. And SystemLink et al. 2021 found MI to be to be as efficacious as compared to CBT in the treatment of alcohol use disorder, while Tekla et al. 2010, I'm sorry, found MI to be comparable to CBT for the treatment of smoking cessation. And so it looks as though, at least with efficacy and efficiency in mind, that MI is pretty comparable to something like CBT. Now, we also want to do some conceptual comparisons of MI to other psychotherapies. So CBT is really more focused on directively targeting maladaptive thoughts and maladaptive behaviors in this directive fashion, specifically using cognitive restructuring and behavior change to ultimately impact and change one's thoughts and behaviors. Dialectical behavior therapy really actually emphasizes the interpersonal effectiveness skills that an individual might have and their ability to emotionally regulate themselves. Again, though, when we compare that to MI, there's a stark difference. MI is really focused on the verbal contingencies and the commitment to change. It's really focused on that change talk. And something that we read about throughout the semester was the stages of change. MI highly emphasizes the stages of change that an individual is currently at and willing to move towards. And what it emphasizes that without being willing to change and finding that internal motivation, it will be difficult for the individual to resolve some of that ambivalence internal to themselves. So then, kind of what's next? So I suggest we take an integrative approach. Much research has alluded to MI being more efficacious when combined with other treatment modalities and interventions, such that when MI is added to other EBTs, effects of treatments are usually improved as far as healthy outcomes, and they're more long-lasting and resistant to the impacts of time than when not combined with other EBTs. One of the most common combinations of MI is specifically with CBT. There's actually been some recent evidence that came out that's saying there's greater treatment engagement and improved outcomes of changing these maladaptive thoughts and behaviors when adding MI to CBT instead of CBT alone. And it really gets back to one of the core ideas we've been talking about throughout the semester of taking on this integrative approach when walking through psychotherapy and interventions, and that no case will exactly be like the next. And beginning to recognize that and allowing that collaborative empiricism within the therapeutic room ultimately to bolster rapport building, and the therapeutic alliance. Awesome. So that's actually all that I have for you guys today. I just have some references here, but I'll go ahead and send that out in the outline. Thank you guys so much. It was actually really fun to get to dive into motivational interviewing and the many aspects of it. If you guys have any questions, please by all means reach out. And I'll talk to you guys later. Okay, bye.